Well, thank you everyone for joining. If you've joined us before, you know that we host these monthly policy briefings that are supposed to be interactive, 30-minute, quick and dirty, what's going on in DC. We usually focus on a specific topic, policy issue. This week we are focusing on privacy policy. And so because this is meant to be very interactive, we host it via meetings instead of a webinar. So you're welcome to unmute yourself and ask a question at any point, turn your cameras on. We'd love to see your lovely faces, whatever you would like. So with that, we will kick it off and I will introduce us. For those of you I have not met yet, I'm Catherine Pugh, I'm the Assistant Vice President of Policy at Executives for Health Innovation. And then our two guest speakers this month are Alice Leiter, our Senior Counsel and Vice President at EHI. Alice is a health regulatory lawyer and lucky to have her as our HIPAA expert. And Brett Meeks, who is Vice President with the Health Innovation Alliance and formerly Deputy Health Policy Director, the Senate Help Committee, where he helped write the 21st Century Cures Act, which is very relevant to our discussion today. So thank you both for joining from Tennessee and from Mexico.
Thanks for having me.
So I'm going to kick off a moderated panel discussion here with Brett and Alice. But again, if you have any questions as we go along, please do chime in. But just to kick it off here, with our theme of talking about federal privacy policy and what's been happening here in DC around privacy. We've been doing a lot here at EHI, and by we, I mean Alice has been doing a lot here at EHI about privacy, but we're just here to give you kind of like the top line key takeaways that you need to know. So with that, Alice, Brett, what are some of the recent developments that have helped shape the current national dialogue around health data privacy?
Brett, you want to go first, or I'm happy to kick it off?
Sure, happy to. First, thanks for having me. It's good to see everyone electronically, although most people don't have their cameras turned on, so shame on all of you. And I'm sorry to hear it's so cold. It's 72 in Nashville today, but it's not Mexico.
Oh,
so,
you shamed Brad and our PSD chair into turning his video on.
So privacy is one of those things where it's like there's always something going on, but if you're, like all of us are fixated on federal policy and what's moving and what's not, and there's always nothing going on with privacy, unfortunately. So it seems to be the theme at the federal level that there are more and more proposals, more and more bills that come out. One that I'm here to talk about today as well, just to further complicate things, but there's still just gridlock when it comes to Congress actually passing a new federal privacy standard. Obviously, we're here focused on healthcare, so it's all HIPAA and what Cures has done and what happens outside of HIPAA now with APIs emerging everywhere and the questions about health data privacy. But Congress is more focused on the consumer side of it. There's seemingly every other week there's a new hearing at Senate Commerce Committee or House Energy and Commerce Consumer Protection Subcommittee and the Consumer Protection Subcommittee in the Senate on this topic. Over the last few months, I think they focused a lot more on sort of the China angles of things, but I think you're seeing a switch back to healthcare. So this sort of continues. The question is, what do we do about apps and these non-HIPAA covered entities getting health data that has traditionally been protected now that there's this sort of backdoor through a patient access API that is already live in some contexts and will be required to be live later this year. So what is happening is Democrats are still dug in that they want a direct private right of action, and Republicans want one federal standard, and they're just no one will move. I think the most latest big development is that last November, House Republicans and an Energy and Commerce Committee put out a framework for what they think privacy regulation should look like. They've actually put out a bill since then, I think about a month ago. Notably for us, that does not have a HIPAA carve out, but does define health data. So this is, FTC land, and it's focused on consumer data, but they do further define health specific data as a subset. So, what that creates for people who live in the HIPAA universe is potentially more layers of regulations. You still have to follow HIPAA, and you could have some business lines or services that fall under this new construct. That's assuming that passes. Everything I'd say is still at a standstill when it comes to federal action. Most of the action is most of and probably better than me, is at the state level. More and more states are considering and passing privacy laws. So this sort of adds to the patchwork and the need for federal action for there to be consistency, because all of this is great if you're a privacy compliance attorney, right? But it's not good if you're actually trying to follow the rules or understand what the rules are. So again, the takeaway is there's a lot happening, but at the same time, not a lot's moving at the federal level.
Thanks, Brett. Well, Alice, I know we're going to get into some more of your work on the non-HIPAA covered data in a minute, but are there any other thoughts you'd like to add?
Yeah, Brett and you, Catherine, and probably all of you on the call are tracking the ins and outs of legislative developments more than I am. But I do think that in the absence of anything definitive or really, as Brett said, lots happening, nothing moving. I've been mostly focused, as many of you probably have too, on what the private sector is doing in terms of health privacy. Many of you are familiar with the Karen Alliance, which has been working in this space for a long time. They were sort of some of the first to get together a coalition of people focused on this concept of health data leaving the healthcare system and needing increased privacy protections. They've been a little bit more focused on how to protect data that either originates with or is staying in the healthcare system through EHR related platforms. They've also more recently been working very intently on identity verification. That's a small element, not small, but it is an element of privacy discussion of how to verify that the data is what we say it is, what we want it to be, whose it is that we think it is. That's all part of this overall umbrella of increasing patient access to health information, which has been long a focus of privacy advocates, healthcare advocates, and even the previous administration of getting more patient data into patients' hands. The issue, and then of course that was sort of pushed forward in the national consciousness by the information blocking regulations that have now been out for over a year. That's all to say that more and more data is in the hands of individuals. Some of that is protected by HIPAA, depending on the platform the data is stored in or shared via, but increasingly it's not held by platforms, by companies that are covered by HIPAA. And as a result, as Brett said, you get kicked into FTC land where the companies are really beholden to following their terms of service. But if they don't, the recourse for either identifying or resolving privacy issues or complaints is really lacking, so to speak. So you all probably are familiar with the work we've been doing at EHI in conjunction with the Center for Democracy and Technology on a private sector effort to shore up protections for health data. But I just do think in general that is sort of the main focus of conversation in probably more work groups than I can count that are trying to figure out how do we all come together in the absence of federal legislation in trying to get ahead of the states who are working very, very quickly and more nimbly than the feds to pass and implement new laws and regulations. What can we do outside of the state level and the federal level to make sure that all of this wonderful consumer health data that we want to be liquid, that we want to be shared, that we want to be user generated is both stored and shared in a privacy protective way. So that's not necessarily something, a development to point to. But the last thing I'll say is that I think all of us privacy nerds have been thinking about this for a very long time and think it's always the hot topic in health privacy and in healthcare. The COVID pandemic really thrust that into the more popular consciousness because all of a sudden health data was something that you need to share or have access to or be storing in order to go out to dinner or go to a concert or even get vaccinated and feel comfortable about it. So I don't want to say ever that there is a silver lining to COVID, but I do think the urgency now to make sure that consumers feel comfortable having their health data stored on apps that are on their phone that they need to show multiple times a day, that sort of day in, day out relevance that it now has to so many that it didn't before has in some ways been a good thing. I think it's increased momentum on the Hill. It's certainly galvanized these private sector efforts that I was talking about. And we're always hoping for more HIPAA education. And by that, I both mean education about what HIPAA is and also what HIPAA isn't. I would say there are more people now who know what those laws are and what they do and do not cover them before. And that's always a good thing.
Well, thanks, Alice. I think you actually really summed up nicely the next question I had for you. So I'm just gonna rework it here a little bit, but you talked about your self-regulatory framework that EHI has been working on and all of the private sector efforts. And Brett, you mentioned the legislation that you've been working on. So I'm gonna ask kind of both of you, starting with Alice, why did EHI, it's a funny question for me to ask, but it did happen before I joined EHI. Why did EHI decide to go down to pursue the idea of a self-regulatory framework? And how does this kind of fit into where we are nationally in the privacy debate?
Sure. I won't spend any real time on this because probably most of you are familiar with this, but just what Catherine's referring to is the EHI CDT Consumer Privacy Framework for Health Data that we released in 2019. It's a very detailed, lengthy set of data use standards that would cover all companies who store health data, but that are not protected by or are not HIPAA covered entities, such that the data they store is therefore not covered by HIPAA and not subject to HIPAA's rules and responsibilities. The accountability component of that is what we think distinguishes it from some of the other sets of best practices and codes of conduct that are out there. And over the course of the past year, the second phase of our grant from the Robert Wood Johnson Foundation, we more fully developed the idea for a self-regulatory program that would govern these data use standards and really be the first self-regulatory program in the healthcare space. There are plenty in advertising and in a number of different financial sectors, financial services in particular. And so we modeled our proposal off of those, but have given it a more tailored flair so that it would suit our needs better. I'm sure all of you were on our webinar last week where we released two papers that we wrote as part of the second phase. Mine is called The Case for Accountability and fleshes out really why we need this private sector accountability mechanism, why we think self-regulation is the right path to take, and announcing that we've chosen BBB National Programs, an independent nonprofit organization to run, to house and manage and run this self-regulatory program. The reason that we chose self-regulation is because we looked at our set of options of how to impose accountability as a spectrum. On one end of the spectrum, just to be really blunt about it, is to do nothing, status quo. The other end of the spectrum is a perfect unicorn federal comprehensive privacy legislation that's passed right now. Neither of those two things is viable. One, we've just seen over and over and over again that the harms and risks and even inequities that come from the misuse of consumer health data are such that we need to do something. We have now said a million times that we don't have the federal legislation that we hope is coming, but certainly isn't now. And then if you move along the spectrum, we really wanted something that had teeth, that had actual accountability and consequences for those who set themselves out to be doing the right thing, as most companies do with their lengthy and detailed and nuanced sets of terms of services and privacy practices. But there's really no one to hold them accountable to what they say they're going to do, other than, of course, the FTC's Section 5 authority, which is just the FTC is too small and not set up to be the nation's policeman for individual personal data, let alone health data, which is, we think, is a particularly sensitive type. So an independent third party that is both recruiting members to be part of this framework to help them be educated about what these standards are that we think are the right things for companies to be doing, kind of setting a standard set of terms of services, and then conducting annual assessments, detailed onboarding, compliance reviews, audits that really would make sure that there is not only a sort of certification or attestation that these companies are doing the correct thing or the responsible thing when it comes to data stewardship and governance, but that there is accountability and remediation and the potential to either help them get better, or in the worst case scenario or best case scenario, depending on how egregious the actors are, kick them over to the FTC as a direct referral pipeline for there to be actual consequences if they can't get their act together via some sort of corrective action plan. So that was the product of many, many, many months of work, detailed reviews, many interviews, a lot of people on our steering committee and our work group focused on accountability. And that was the idea that we thought made most sense. It's certainly not a perfect solution. It's not the be all and end all. We really see it as both a bridge to future legislation and something that can exist once hopefully there is a new law in tandem with it, and work sort of as a private sector way of enforcing or ensuring accountability above what usually tends to be a floor when it comes to federal law. We've heard about how the feds aren't able to be as nimble as we like. We hope this framework and the accompanying self-regulatory program can be a little bit more evergreen, more easily able to evolve as the landscape changes, better able to keep up with technological developments. So we don't just see it as an intermediate stopgap, but something that can grow and be nimble over time and sort of backstop and support eventual federal legislation.
Thanks, Alice. That was a very good recap in a short amount of time. Brett, I wanted to turn to you because HIA went down a slightly different path and went more in the legislative route. So I just want to ask you, how do you see the legislation that you've been working on, which actually EHI has endorsed, full disclosure. How do you see that fitting into continuing the dialogue around non-HIPAA covered data?
Yeah, thank you. And it's, the short answer is, I hope the legislation moves because we think it's a good middle ground and an important discussion. As Alice points out, we're waiting either for inaction to continue or the sort of perfect bill that, I mentioned in the opening is just kind of not there because there's too much digging into your own trenches. So what, HIA actually, when Catherine, when you were still there, had started this health data privacy working group, and I actually joined it as a participant before I was there. And what they were trying to do is build what's the model bill, and it would have been one of several, I think, but it ended up just sort of being principles that were released, and that I think there was still a good bit of disagreement on. So once I started in the middle of the pandemic, everything sort of switched around, including my job. What we decided to do is take a step back, okay, Congress is divided. This issue is very divided. The Senate is split down the middle. You're probably not going to get a lot of controversial, incredibly difficult topics to pass major legislation, either rewriting or revisiting HIPAA or consumer data privacy in this Congress. But this is a live fire, right? Because of information blocking and the cures rules being implemented on an ongoing basis. So we went back to a bill, believe it or not, that was in the House in 2000 from Asa Hutchinson, a bipartisan bill called the Privacy Commission Act. And we went through and updated it and reworked it. And
is that bill online, Brett, or did you have to go over to the
you can find it on congress.gov. It's HR 4049 from the 106th Congress. And we I totally reworked it. But I guess my point in bringing that up is this is not a new issue, right? So this whole like ideal federal bill, like there was the idea of having a privacy commission to tell Congress what to do 22 years ago. That bill obviously didn't pass. But even if you go back to HIPAA, I'm sorry, I'm kind of on a rant here. Congress was required to act to say what health privacy rules should be, and they timed out because they couldn't come to agreement. So the privacy rules, we know it, it's completely a regulatory construction. So we're kind of running into the same issue here. The Congress kind of can't agree, and there are tons of groups, most notably, from the federal side, National Committee on Vital and Health Statistics, and then the HITAC and their predecessors, the Privacy Committee and Standards Committee for ONC, that have recommendations historically on what to do with privacy. But they're old and they're sort of scattered and they're not combined. So we're like, all right, what we need is some sort of committee to stand up and very quickly dive into these very complicated issues and analyze them and issue official recommendations to Congress for what to do and how to do it, so that Congress has a blueprint to respond to and pass a comprehensive privacy law, but specific to health data. Because so much of our concern is all these conversations are around consumer data, what's happening with your apps, like, is it a good compromise that Uber knows every corner you're standing on, but like you can also get a car pick you up wherever you are, is that good enough, depending on whatever their terms of use say in the Section 5 authority, like Alice said. But for health data, it's very different. So like I mentioned, the House Republicans, I mentioned that because it's kind of an assumption that the House could flip and Republicans would be in charge after the midterms this year. So next year, if House Republicans are in charge, they've laid out the blueprint for their privacy bill. And it is pure FTC land, but it has health data as a subcategory of significant and sensitive data that needs to be treated differently. So that creates another layer of regulation, doesn't fix the HIPAA problem. So we thought, all right, we still have time. Let's come up with this bill, give this commission needs to stand up very quickly, needs to issue a report within 6 months to tell Congress what to do. And the hope was this bill would have actually been out last year. It took a year for us to get it introduced. Once we got Senators Cassidy and Baldwin behind it, we started shopping it to groups. You guys were very kind and joined on. A lot of groups, no one came out in opposition, but people have their trenches dug on this issue. And they're like, well, we don't want a commission because we have our blueprint out and we want our blueprint. So that's kind of, I think, where we are in the privacy landscape, but that's where we came from with this. It's like, this is very complicated. Congress needs to do something and someone needs to tell them what to do, because the last thing you want is, Congress just doing something because it's politically, they have the votes, right? It needs to be the right thing to do, specifically for health data. So we got the Health Data Privacy Commission Act introduced earlier this year. It's just a Cassidy and Baldwin vehicle now, but a lot of folks are interested in it. And we're working on getting a House companion introduced. I've actually got meetings this week. And the reason, it's a commission, as someone who's worked in policy a long time, it's not very sexy to be like, we have this bill to have a commission, or like it's a study, it's a report, right? You actually want to solve the problem, but because this is so complicated, we went the commission route. And again, back to where I started on this diatribe, at least, this is probably the only thing that could pass in this divided of a Congress. So like there's a user fee agreement, there's some more things that could happen this year. And this is just a commission, even if you have your principles that another organization you're a member of has really endorsed and gotten behind, you put a lot of work into it. Like all this does is make recommendations, and it shouldn't harm anyone and should add to the conversation and hopefully get us closer to having a comprehensive federal law.
Well, Brett, that's a great point. It's not, commissions aren't sexy, reports aren't sexy, but I know that you know this, but information blocking started with a labor aid appropriations request for an information blocking report from ONC back in 2014?
Yeah, I think the approps bill went in 2014. The report came out in 2015. and cures passed in 2016.
Yeah. So it can start with a report, it can start with the commission. Well, thank you both. I want to open it up. We have a few minutes left. I want to open it up to the audience if there are any questions for Brett and Alice. And I think I also kind of want to turn it, our usual Q&A section, on its head and ask you all who are on the call if there are specific issues that you're tracking at either the federal or the state level, because we know, Brett, Alice, and I are very focused at the federal level, but we know there's a lot of action at the state level and it moves quickly. So I wanted to ask anybody who is willing to share some of the priorities of your organization as you're looking at privacy issues at the federal and the state level. Or if you have any other questions for Brett and Alice too.
And even if something is not coming to mind right now, we're always, at least at EHI, we're always evolving our priority areas of work. We're always looking to hear what our members and our friends and colleagues are working on to tailor our work to that. So even if it's not something that comes up right now, please feel free to be in touch with us about things you think we should be tracking, things you think we should do webinars on, reports you think are begging to be written. We're all ears.
Joe, hi.
Catherine. So a question for both of you, is it sort of a foregone conclusion that healthcare data that sits outside of HIPAA needs to be regulated in some way, shape, or form? And part of the reason I asked the question is, I think that's an area of a lot of concern. Brett, I think you mentioned the possibility of kind of overlapping or conflicting regulatory frameworks between data that's within HIPAA and then data that's without HIPAA, but it's the same data and it might be subject to two different kind of regulatory frameworks depending on who's holding it or what you're doing with it. I think that's an area where we have a lot of concern about conflict and overlap. And I guess the question is, maybe provocative, maybe not, but why wouldn't that data, if it's outside of a HIPAA covered entity, just be consumer data and be subject to whatever the consumer data regulatory framework is?
I'll start, Brett. I don't mean to cut you off. I love that question, and I don't know that I've ever thought about it. In my mind and in my world, yes, it is a foregone conclusion. And I think the reason is that as much as the lines between consumer data and health data have been blurred over the years, and I mean that bidirectionally, because there is data now that wasn't previously thought of as health data that now, given how much data there is and how easily data elements can be combined, social determinants of health data, geographic data, housing, employment data can easily become health data when combined with other elements. And then of course, vice versa. Health data now is consumer data, just like any other purchasing habit or any other sort of data. I do think though that even though those lines are getting blurred, I have never heard anybody say that they don't think that health data still constitutes a particular type of sensitive data, that the harms that are possible or realistic that can come from misuse of health data are such that they deserve special protections and therefore should not just be regulated as purely consumer data, but that they deserve special regulatory protections. There's a great paper to be written on a case for why that isn't the case, but I do think it's this sort of special sensitive status that kicks this idea of consumer health data into a different and more vulnerable and therefore more in need of regulation category than sort of regular consumer data.
And I know we're at time, but I agree with Alice. I do think it's a foregone conclusion for two reasons. One, people do think healthcare and data is more sensitive, like your lab results, for example, like you have herpes, you may not want like everyone to know that, right? It's a horrible example, but it's just, that's where my mind goes, right? And like sensitive data in this House discussion draft, health information is the top, biometric is another one, precise geolocation information. So all these things that are just very sensitive and very specific to the person, I think are sort of predetermined that yes, it will be called out. And the other side of it is if you think about wearables, and you think of like a safety sort of FDA hat side of it, if that information is being used and it's not regulated, how do people know that it's accurate, right? So, FDA will send letters, cease and desist, or it's come to our attention that you're making health claims when you're not an approved device. So I think it is sort of a foregone conclusion that health gets regulated. And we think it's so important to get it right because we don't want to go backwards. Like, we want health information to flow. We want to improve clinical research, make trials decentralized, and have better access to research and clinical trial information, right? We don't want to go backwards and have some consumer bill pass and us have to, lawyer our way back where the gains we've made over the last 15 years.
Thank you.
And thanks, Joan. Thanks, Brad. I think that's a great point. Not only, I think health is unique in that it's sensitive and should be protected, but also unique from consumer data as it has so much potential for public good too, for use for research and other circumstances. We are over time now, 2 minutes. I don't want to cut anybody off though. If there are any other questions for Alice and Brett. Okay.
Thanks for
Well,
joining.
thank you all. Thank you all for joining. We will have we'll be back to our normal third Tuesday, 3 p.m. schedule next month. We rescheduled this month because of the HIMSS conference, but we will see you all next month and keep an eye out for the invite. Thanks so much.
Thanks, everyone.